thank you so much for that insightful presentation. I like the last part about collaboration, especially with the HSRC. They are here, so they've heard for themselves that we would like to revive some of the work that we started as the province, which, yes, maybe people at national level have more capacity than we do, but we wouldn't mind that you still come back and collaborate with us as the province. As well as the part on the loss to follow up, that you know the people you live with as the civil society on the ground. Maybe we need to collaborate with the DOH in finding those people who are lost to follow up, but that I will leave to the Department of Health to look into. I would like to, because we are pressed for time, but we will allow some questions, just 4 questions, and it's not because we want to close people out of the discussion, but because we know that we are cognizant of the fact that some people still have to travel back home later today, and we would like that we do not do hit and run on the program. So we will allow just 4 questions for now, and we're hoping that colleagues won't take it as we are closing them out, but I would like to suggest that we continue with the questions during tea break if we still have some questions that we would like to ask from our presenters. For now, just 4 questions that we will open time for. Any takers? Questions and points of clarity, please. Unless we're saying that the questions were, the presentations were quite clear. Ms. Bottoman, I thought that your hand was up.
Thank you. It wasn't up, but now that you have pointed at me, so I've got to say something that, I was thinking about silently. Colleagues, I think we all understand that when it comes to female condom, it's not popular. And I've been whispering, in this table into saying that culturally, men are in charge. It might mean a woman brings the condom, but then the man says, not this one. So meaning that even men should be incorporated, in the sessions that, whereby awareness are done when it comes to female condom. Thanks.
Thank you for that, Ms. Bottoman, which I think we could always put in the table of the Department of Social Development, because they have Families Matter program, I know. So maybe that's something that they could also include. Mamekuto, sorry, but yeah, shoved you under the bus. I see your hand, sir. Thank you.
Good morning, colleagues. Good morning, Doc. Thank you to the team that has presented for the informative session. I just want to check, because this is one of the things, I work for Bumbingomso in the youth program for HIV prevention. I just want to check, maybe because this is a platform where HSRC that looks at what's going on nationally is in, and many people interested in research. Part of what was reported by Mr. Somael is the difficulty to find the people to put on treatment and losing some of those that are already on treatment. But on the other side, we're doing very well in tracking the number of tests we have done. Is it not time maybe for the department to consider revising that indicator to look at the number of people being tested? Because if we track the number of tests being done, you can test the same person over and over and you shoot that number up. But it means you will not be able to put more people on treatment or get more positivity results because you're testing the same people that already know their status. Thank you.
Thank you, sir. Okay, Ms. Bodoman is clapping for that one. All right, any other takers, colleagues? Or maybe we will ask the presenters when we go outside, when we're having tea break. Mr. Somaela, may I give to you, especially for the last one? Thank you, sir. Sorry.
Can I pin the question, Mr. Mongwe?
No, Mhlekazi, ndibuza uba, is it something that the department is considering? Uba ndaweni uba sibali test esizenzileyo for utreka i-HIV. Sibali abantu abatestiweyo because kuyenzeka uba umancane enyakeni ateste mhlambi kabini kathathu depending on the circumstances. Now, sizawubala ii-test ezintathu ezenziweyo, but besenziwa noma ncane yedwa. Whereas if we track the number of people we test, sizawukwazi ukuthi kwezi test ziyi-100, siteste abantu abayi-70, and therefore si-expect into okokubana abantu that we might initiate kwi-treatment must be a percentage of that 70, not a percentage of 100.
Oh, thanks, colleagues. We do record the people that we test. They are registered in our facilities. But the direction of the indicator is saying, let's count the tests. This is an area that really is a concern because we don't consider the duplicates. I don't know, we even sometimes we off the view that we are even testing people that are already on treatment, who somehow wants to move from facility to facility in order to get themselves accepted in that particular facility, while they are defaulting in another facilities, only to be started again as new patients. So unfortunately, when we don't have a gatekeeping system on the testing, but we do have a gatekeeping mechanism for initiation. And you'll find that most of the time you'll find more patients are tested but less are initiated in certain districts because of that gatekeeping process. But for cases of testing, maybe the circles here, the champion for indicators and information management in terms of what to consider excluding the issues of duplication. Maybe we might want to consider on the new inputs. I'm not sure. She wants to comment.
It's okay, Mr. Somel. Thank you.
Thanks, Chair. He's putting me on the spot. I thought I sneaked in. And good morning to everyone, and morning, Doc. I think Mr. Somela is right. We have, and I'm specifically now in a PHC facility. We have PHC facility utilization rate. This counts the patient and how many times they come to a facility in a given month. Now, our data suggests that our patients don't come more than 2 times in a month. As a province, as Eastern Cape, we are standing at 2.1. That's the first fact. So on average, our 0 to 19 and 19 and above will not come to a facility more than 2 times. And so already you can see that, duplicates could be there, but they are not necessarily a big factor. Secondly, for the testing of all ages, we do have an exclusion in the definition and in how we record it. And the exclusion says that do not count repeat tests. So it's a matter of us, possibly as a department, reinforcing that when the clinician is in the room with the patient to say, remember not to double count the patient twice, because it's standardized. It's required that as you test the patient, check if you have not tested them before. So it's just that messaging issue that we need to, to make it known to all the people that we are testing. Just moving on, I just want to say also still, colleagues, the fact that we are testing what is supposedly more than our target, and we are on the surface doing well, still doesn't mean that, we don't have a problem with initiations. Because even if we are testing more, it's good actually, because it means we are testing everyone. Do you see what I mean? We're testing everyone. The question still remains, where are the positive people? Anyway, we are testing over 100%, so we're testing everyone. Let's assume that we are also retesting, we are duplicating. But the question still remains, even in our duplication, we are still not finding the ones that are positive. And I'm sure this is where Mr. Somayela and all our civil society partners, this is the reality, as Utatumeli has said, that we need to consider. Could it be that, eventually, as Eastern Cape, we are really making inroads in our positivity yields? Maybe, just maybe, that, all our societal and behavioral and awarenesses are finally yielding results to such an extent that, our people are no longer becoming as positive as they used to. The third point, Eastern Cape has lost a substantial number of a population, and a population is a denominator for everything else. Our people have left for Cape Town and for Johannesburg and for other provinces. And so we have issues around our population. And I think Chris Honey, as well as George Gabi, are a point in case. Because the denominator for condom distribution is males 15 years and older. So it's not necessarily a good performance per se until you check how many males that are 15 and older are actually there in the two districts. So as we analyze data, we look at that. They could be doing 120, I've seen 129 for Chris Honey, but the question is, has the population that we have given them of 15 and above still there in the actual district, or they have left the province? And actually, when you look at the STR, you can see that these condoms are distributed. They're taken out. But whether they reach the bedroom, it clearly doesn't show that, because our STIs still remain high. And I'm glad, Mr. Somayela, that we have the partners, the people who are able to advocate for change, behavioral change at community level, and we do really appreciate all the work. And I'm also privileged to be sitting next to, CDC, Dr. Blandford, and I'm sure he has heard your cries. Everyone was saying funding and funding. And when Daddy's here, we know that hunger is gone. So thanks, Chair.
All right. Members, ngiyanibulala ngohlobo kodwa ke ngeke ndinivalele ngaphandle. Mr. Nokampula, then Reverend Novuka. Thank you.
Thank you, Program Director. Thank you for also the last speaker. Some of the points covered very well. We are just look at the program, celebrating the 20 years. This is a milestone. And the very fortunate part in this milestone, I have a privilege of working with the team in the Nelson Mandela, where they are doing a research on TB. Also, when they are doing key pops in the Nelson Mandela, I was there. So for me, it's a privilege also to meet them after plus minus 15 years ago. Mr. Davids and Dr. Hussein back in the days. But thanks, is still alive, he's here. Mr. Davids, thank you for seeing you here. My comment, not questions, but something that we need to take it back home. Just to remind the Department of Health that the PLHCV sector got an MOU at the national level. And that MOU escalated to the provinces. And we found that in some districts, PLHV colleagues who are on program of receipts and program the project of SANAC are not allowed to enter in the facility to assist in terms of education and taking party, giving flyers, taking condoms and distribution. That is not happening. There are gatekeepers who want letters from district or letters from the PLIHV sector as an entire organization. So this is the package, Mr. X, which I'm giving you to take it, that should be an end, because we are here to assist and to work as a collaboration as a sector. Secondly, you will show us in your slide the part of condoms, but I didn't see how is the lubricants in the Eastern Cape going and the availability. If not available, why the lubricants? Thank you.
Thank you, Mr. Nogambula, Ref.
Morning, everybody. We call a talk. Okay. It's such that when I talk, and go familiar and does a research. But I'm noticing something, and then in the Anita, clarity. Ukut. When you reach targets, you reach your own targets, eh? Does that mean you've reached even impact? It targets, reaching the targets, diminish and only to the impact yalentu yenzayo. Ndifuna nje ukhe ndicaciselwe apho, because you'll find every time we've reached the target, we overreached it. But is that talking to impact to the community or whoever? Thank you.
Thank you, Rev. Mr. Nogambula, ibingumphako to the DOH, umfundisi, maybe singanikela kuwe, Mr. Somanela, kule question about, now that you have reached the targets, does that translate to an impact having been made to the people that you are servicing? Then I will give over to Doc. Thank you.
Okay, thanks, colleagues. Look, what I've presented here are the activity outputs. Report is not the impact reflection of what we want to achieve as a province. I think the assessment of impact will have to follow a different direction. While reporting what we have done, and we're given a target based on what is expected to be done, and we're reporting on that one. Then I'm sure this study that you colleagues are going to reflect to a certain degree will indicate the impact of what we have been doing. Thanks, Chair.
Thank you, sir. Thank you, colleagues. A big round of applause for the presenters and the colleagues who participated. Thank you.
Thank you so much, colleagues. So we have now ended the first session of our program, and we are shortly going to take a tea break, noting that we are very late because of having started late, but we are going to have to try to rush through some of the activities. So we would ask that as we go for tea, we just grab what we need and then come back so that it's a working tea, and some of the discussions that we've had then can continue in the small groups that we have. Also having an opportunity while we have some of the colleagues here that you can also just have small discussions with them. So after tea, we also now want to get into the HSRC results. So we are going to just a bit of context, especially for those that we don't even know what HSRC is. We're trying to figure out what this sub-sum is that we are talking about. So we're just going to play a video and then get into the results. So we are also pleading with the colleagues that have joined online, do not move away from where you are. The session is not ending anytime soon, and then we also are ready then to also share. Noting that we know that you are jealous of us here and you want to participate in activities that we have. So we just quickly created a snapshot of the gallery that we have here. So we're just going to display that online just for you to also reflect. You've seen some people reflecting, some suggestions that came out of that reflection. So we also want to give you an opportunity to also reflect while we are grabbing our own tea. Obviously, after looking at the video, you can just quickly go to your kitchen, grab a tea, and come back and sit and watch us while thinking about what you want to type. There will also be a QR code of some sort that would also allow you to also type in your reflections based on that video. So we are trying by all means to also keep you busy. And you'd have also seen that Yolandi also allowed you to also express whatever question you have, a reflection that you have as we are going on with the session. So you may not be able to talk to us, but we are also looking at you and also making sure that we are allowing you to take part where possible in the activities that we have planned. So colleagues, if we can just try, it's now 11:30. If we can just try to make sure that by just 10 minutes of us, so by 11:40 we are back, if that would be really appreciated, just for us to grab and come back